All right, what type of scar treatments are available after a tummy tuck? So my basic protocol is tape therapy, scar therapy with silicone for about 3 to 6 weeks. If a patient desires to go to do extra after that, then it would be either lasers or other type of treatment modalities that I would refer out to a dermatologist. What's the difference between a mini and a full? Is very simple. A mini is a short scar, only removes skin. Full is longer scar, but also fixes the muscle. In general, I think most patients benefit most from a full. I think that if you do a mini, chances are you may not be satisfied with it because it could, with a short scar, you could only remove a very small amount of skin. Obviously, if that's what you want, great, but the majority of patients are looking for more of a dramatic result that would only be attained with a full. Can a tummy tuck help with back pain? I think in general the answer is no. Maybe there's some extreme cases of patients who have like very long or heavy aprons of fat. I'm talking about like extreme cases where people lose 300 pounds. But for the average patient who's a mom, had a couple kids, normal BMI, even higher BMI, it's not going to relieve back pain. Abdominal muscle stitching. Did I rip my stitches? I get asked this a lot. So I think you can rip your stitches. It's very uncommon. We also do what's called progressive tension sutures, which means we put other sutures in, other stitches. Those are more common to rip. If they rip, it's not a big deal. To actually rip the plication would be very uncommon, and it would be very obvious. You would suddenly like wake up and it would be totally expanded and full again. So it's possible, but not common. Tummy tuck and liposuction at the same time. I can't speak for other surgeons. My patients, I always do lipo and tummy tuck at the same time. The degree of lipo may vary, but almost in all cases, I do a 360 lipo with an abdominoplasty at the same time. DVT and abdominoplasty. DVT is a deep venous thrombosis, is a clot that occurs in the venous system or in the veins. It can happen after any surgery. We prevent it by giving some patients blood thinners. So all my tummy tucks get blood thinners. This is not standard, meaning that surgeons don't have to do this. I'm a little bit extra cautious with this, and it's a personal preference of mine, but it's not considered standard and that everyone has to do it. Exparel and surgical procedures, does it work? The answer is yes. I like Exparel. Exparel is a long-acting anesthetic. It's a medicine we inject at the time of surgery. It lasts for about 2 to 3 days. It helps decrease post-operative pain, post-operative narcotic requirement. In general, it's a good thing. I use it on all my surgeries. So complications after tummy tuck, there's a long list. I'm gonna give you the short version of it. The most common are wound problems. Wound problems could be something simple like wound separation, where the actual wound separates. It could be a little bit more problematic, like necrosis. And necrosis could either be partial or full thickness. It could be very small, like the size of a quarter. It could be much larger. You could develop seromas, you can have infections, you can bleed. Those are kind of standard complications after tummy tucks. Tummy tuck or liposuction, how do you decide? Ultimately, it's a conversation between the doctor and the patient. What I do with my patients, I sit down, I talk to them, and I just explain the benefit of each procedure. For example, lipo is going to remove the fat, it's going to bring in the waist, it's going to flatten the stomach. It will not change the loose skin. So if someone really wants to remove the skin and they want the skin gone, they need to do a tummy tuck. If they're not sure about it, I say just do the lipo first, wait, and then you can always come back and do the tuck later, usually 3 to 6 months later. Can you break your scar open? How common is that? I would say in the first 24 hours, maybe. I've never seen it happen, but maybe if you did something crazy. But after 48 hours, the integrity of the wound continues to get stronger over time. By the time you get to 3 weeks, it's 30%, it's normal. By the time you get to 2 months, it's 80% normal. So no, you're not gonna rip open your stitches, but yes, you have to be careful post-op. Can you do things before surgery to help you heal? I think the number one thing is gonna be hyperbarics, pre and post-op. I think that also just being a normal BMI, having good nutrition, taking antioxidants all help a little bit. But ultimately, how you heal is how you heal. And besides hyperbarics, I don't think there's anything out there that's really going to be super high yield for healing, assuming of course the patient is well nourished, hasn't had any medical problems, good nutrition. Why do you use drains in plastic surgery? There's 2 different reasons. 1, to keep an incision open to allow fluid to come out. That's why we use them in lipo. 2, we use them anytime we lift up skin and elevate a flap. That could be done in a facelift, a breast lift, a tummy tuck. When you elevate skin, you create dead space, which means open space, and that space does accumulate with fluid. And what the drain does is help remove that fluid and blood until the space can stick down and close off. When can I travel after plastic surgery? Usually if it's a local trip, I do 7 to 10 days. If it's going to be more across country, I would say 2 weeks. 1, what are the benefits? It removes extra skin, and it also brings in the waist with a muscle plication. 2, what does the tummy tuck address? It addresses muscle separation and loose skin. 3, who makes a good candidate for a tummy tuck? Any patient with extra skin, who's had kids, who wants to remove the skin and bring in the waist. 4, how is a tummy tuck performed? We make a cut, we lift up the skin, we remove the excess, and then we close. We also take stitches to fix the muscle. What to expect in the recovery? Here's what you don't want to do. You don't want to go home, pop up a couple pills, and just lay in bed and do nothing. Your lungs are going to get sick, you're not going to go to the bathroom, your pain's going to get worse. So what you want to do is you want to move around, you want to have good pain control, you want to do what's called an incentive spirometer, which is a machine that you blow into to help expand your lungs. We do all this stuff in an aftercare. That's why aftercares, I think, are so important for tummy tucks. I send all my tummy tucks to aftercare because you really need someone next to you telling you, hey, we got to do this stuff. So recap: incentive spirometers, early ambulation, SCDs, sequential compression devices while you're in bed, and some surgeons give blood thinners. I'm one of them. Yeah. Surgery risk, blood clots. Why do you get them? What can you do to avoid them? So it's a known risk of surgery. It happens from general anesthesia, from going to sleep. If you technically want to know, on induction, when you go to sleep, your blood pressure drops and it causes stasis. Stasis means lack of movement. So the blood pools and there's a higher risk of it forming a clot. That you should do to avoid them post-op: you have to move around. That's why I send all my patients who do tummy tucks to recovery centers. They're forced to move around every couple hours. 2, patients could take blood thinners. That's doctor specific. I give just most of my patients who have tummy tucks do receive a blood thinner. That's about all you can do. Early ambulation, blood thinners, and SCDs. SCDs are sequential devices. I don't think TED hoses, like tight compression, makes a big difference. But the sequentials, the ones that are actually mechanically moving your calves after surgery, those do make a difference. Thanks so much for watching. If you enjoyed the video, drop us a comment, give us a like, subscribe. I'll see you in the next one.